We're answering a question on osteocytes, where we'll be talking about everything that has to do with osteocytes. Okay, so it was a question in exam where students were asked to write short notes on osteocytes. So osteocytes, osteo is bone. So osteocytes is just like cells that make up the bone. If you literally ask me, right? So osteocytes just like cells that make up the bone. But now what is needed is the right English to put this to be appealing, right? So you can see that osteocytes, the matured osteocyte, they actually were developed from the osteoblast. Okay, so like it's like a step before you get an osteocyte. So we'll be talking about osteocyte from the definition. We'll talk about the functions. We'll talk about the characteristics. We'll talk about the role they play in bone health. They will talk about if there's a dysfunction of osteocyte, because as a medical student you are learning about the normal to be able to know about the abnormal. Okay, so let's go from the definition. We said that osteocytes are mature non-dividing bone cells that are embedded in bone matrix. Okay, so they are the most abundant cell type in bone tissue, making up about what 90 to 95 of all bone cells. Okay, so they make up 90. If you have a bone here, all right, the 90 to 95% of this whole bone is made up of what? Osteocyte. So talking about their functions, they maintain bone matrix and mineralization. Okay, they regulate bone metabolism and remodeling, how the bone will actually come back to life if there's any problem. They respond to mechanical stress and load-bearing forces. They produce signaling molecules for bone cell communication. They communicate to the bone's mechanosensory system. Okay, so these are the functions of the osteocyte. So just know that if there's any dysfunction, all these functions will not be there. There's a problem with your osteocyte, all these functions will not be there. Okay, and more. So talking about the characteristics, you could see them that what they are embedded. So you see that they are embedded in lacunae, which are small cavities within the bone matrix. They are long and they have thin processes known as dendrites extending into canaliculi, right? They connect to other osteocytes and bone cells through gap junction. They express specific markers such as what? The DMP1, that's a dentin matrix protein, and also what? The sclerostin, okay? They express these specific markers. So talking about their role in bone health, they regulate bone density and strength. So if there's any problem with your osteocyte, you find the person having very soft bones. That's what we call osteoporosis. Or you have the person having infection of the bone. That's what osteomyelitis. You are connecting the thing now. They also contribute to how the bone responds to injury or disease. They are involved in bone remodeling and repair. They influence osteoclast activity. That's bone resorbing. Okay. So dysfunction, if there's any problem with your osteoclast now, if there's any problem with your osteocyte, sorry. So dysfunctional alteration in the osteocyte activities has been linked to various bone-related disorders, including osteoporosis, osteoarthritis, bone fractures, bone cancer. Of course, the person will be having very weak bones, and these bones can fracture. Can fracture. Sorry, the person might be having osteoarthritis. That's infections of the bone, osteomyelitis, and this can eventually lead to cancer. So one of these things they actually lead to the other. So I think that's the full note on osteocytes from definition, function, characteristics, role in bone health, and dysfunction. Right? So good luck.